Hello everyone, we are
Alexandra Kalkantzi
and Lize Kleeren from KU Leuven. And in today's podcast, we will guide you through a recently published manuscript, Daily Life Executive Functions and Bimanual Performance in Children with Unilateral Cerebral Palsy.
But first, let us give you a bit of background. Cerebral palsy is a non-progressive condition caused by an injury in the developing or infant brain with direct consequences, movement and posture abnormalities. One of the most prevalent subtypes of cerebral palsy, accounting for more than 1/3 of the total population diagnosed with the condition, is unilateral cerebral palsy, where sensory motor impairments affect predominantly one side of the body and mainly the upper limb.
The impairments on the upper limb can occasionally lead to difficulties in bimanual performance, or simply the spontaneous use of the affected hand in bimanual activities. Those difficulties usually affect participation and overall quality of life, as most daily life activities require the effective use of both hands.
Along with these lateralized sensory motor impairments, some children with unilateral cerebral palsy also experience cognitive impairments, such as difficulties in executive functions. Executive functions are advanced cognitive processes that help us regulate our behavior and are common impairments in neurodevelopmental disorders such as autism spectrum disorder and attention deficit hyperactivity disorder. A few examples where executive functions are needed in daily life situations are waiting your turn to speak, like raising your hand inside the classroom, adapting easily when you are put in a new group, or remembering easily what you want to do or say.
Studies in typically developing children have shown that executive functions are related to fine motor skills and manual dexterity, as complex motor skills, such as those performed by the hands, entail higher cognitive task engagement and therefore require advanced cognitive processes. However, this association has not been explicitly shown in children with unilateral cerebral palsy, despite the fact that those children can experience difficulties both in the upper limb and executive functions.
So with our study, we tried to address this gap by specifically exploring the presence of executive function difficulties in children with unilateral cerebral palsy, potential differences in executive functions according to manual ability level while accounting for comorbid autism spectrum disorder, and also the relation between executive functions and bimanual performance in the target population.
And that brings us to the methodology. Specifically, we assessed 46 children with unilateral cerebral palsy using the following clinical assessments. To evaluate executive functions, we used the parent-reported behavior rating inventory of executive function, or in short, the brief, which is a questionnaire involving 86 statements. Parents are asked to rate the statements with always, sometimes, or never, depending on whether their child's behavior reflects those statements. The scores are presented in 8 subskills, of which inhibition, working memory, and flexibility are 3 examples. Additionally, 3 summary indices that describe the use of executive functions in daily life situations are calculated. For bimanual performance, we used the parent-reported version of the Children's Hand Use Experience Questionnaire, or in short, the CHEC. The CHEC describes 27 daily activities that normally require the use of both hands, and parents are asked to indicate the grasp efficiency, the time spent on task compared to peers, and the way that children feel bothered by the use of their affected hand. Also, the children performed the assisting hand assessment, which comprises a semi-structured play session where items that trigger bimanual activity are used. And lastly, we used the manual ability classification system to classify children based on their manual abilities, with higher levels indicating better manual ability.
Now let's have a look at the findings. For our first research aim, we found that children with unilateral cerebral palsy have significantly more elevated scores compared to the norms in 7 out of the 8 subscales and all summary indices of the brief. These results reflect more impaired executive functions for our population, as higher scores on the brief indicate more executive function impairments. When we excluded children with additional diagnosis of intellectual disability or attention deficit hyperactivity disorder from our analysis, the results remained fairly similar. However, when we excluded children with additional diagnosis of autism spectrum disorder, the results of our group did not differ significantly in executive functions compared to the norms. We further found that 37% of our participants with unilateral cerebral palsy demonstrate elevated or potentially clinically relevant scores on the brief, which is higher than the almost 16% of executive function problems that are expected in the typical population.
For our second research aim, we found that children with better manual ability show significantly better inhibition compared to those with poorer manual ability. Although not statistically significant, the graphical illustrations of the brief summary indices suggested a similar tendency. Lastly, our results showed that an additional diagnosis of autism spectrum disorder has a significant effect across almost all subscales and summary indices of the brief.
And for our last research aim, we found low to moderate correlations, especially between the subscales and summary indices of the brief and the check. This could be explained by the fact that both assessment tools are parent-reported and could be shaded by parental views. In addition, both questionnaires assess daily life situations, while the assisting hand assessment is a more structured tool used in a clinical setting, and this might explain the absence of relations between the brief and the assisting hand assessment.
Based on our results, we can conclude that children with unilateral cerebral palsy have more frequent executive function impairments than reported in the general population. Executive function difficulties in children with unilateral cerebral palsy seem to mainly co-occur with autism spectrum disorder. Children with limited manual ability show more inhibition-related behavioral difficulties. And lastly, daily life executive functions were mostly related to daily life hand use experiences.
Despite our findings, more studies using performance-based assessments of executive functions in this population are needed for concrete conclusions. So, that was all from us. Thank you very much for watching, and to read the full published paper, you can scan the QR code here. Bye!